Now let's begin the procedures for patch removal. Before you remove the PharmChek sweat patch, you should have the following materials: disposable gloves, specimen bag, single-use tweezers, chain of custody form, shipping bag, and a mailing envelope. When the donor returns to have the patch removed, pull the appropriate chain of custody form from your files. First, compare the ID number written on the chain of custody form with the number printed on the patch. If the numbers agree, record the date the patch is being removed on a chain of custody form. The ID number on the transparent covering of the patch is not to be sent to the laboratory. On the chain of custody form, both parties must verify the information and initial the form. Examine the patch. A successfully worn patch should be firmly attached to the skin and be transparent at the time of removal. If the edges of the patch have lifted or rolled during wear, but the patch is still firmly stuck to the skin around the outside of the absorbent pad, the patch is uncompromised and acceptable. The edges of the patch may become dirty while it is being worn. This does not compromise the patch. Notice that on the sweat patch on the left, the clear covering of the patch looks transparent. The patch on the right has been removed and reapplied. The covering of this patch appears slightly cloudy. Skin cells stick to the patch that has been removed. This keeps it from being completely transparent. The sweat patch is designed to stick to the skin for only one time. Note that the patch on the left arm is adhering firmly to the skin. The patch on the right arm, which has been reapplied, does not stick well to the skin and lifts easily away. If the donor tries to alter the patch by applying a substance to the outside of the patch, the covering will most likely no longer be shiny, smooth, or transparent. If someone tries to alter the patch by injecting a substance under the patch's outer covering, several things may happen. The absorbent pad may become discolored. The skin under the pad may become irritated and red. Holes from a hypodermic needle may be visible in the covering. The observer must always wear a new pair of disposable gloves for every patch removal. Before the absorbent pad from the patch is removed, it is required that the person who removes the pad put on a new pair of disposable gloves for each patch. Single-use tweezers must be used to remove the absorbent pad. This avoids contamination of the pad. If you suspect that a patch has been tampered with or has been compromised, write what you have observed on the chain of custody form. This will provide documentation if the patch is unfit for analysis or gives unexpected results. Once the patch ID number has been checked and the patch examined, request that the donor pull down the top edge of the patch, starting from one of the top corners. Using a gloved hand, remove the single-use tweezers. Proceed to remove the cellulose pad by using the tweezers. The absorbent pad is part of the patch that is analyzed at the laboratory. Place the cellulose absorbent pad in the plastic specimen bag and seal immediately. Affix a barcode sticker from the chain of custody form to the outside of the specimen bag. Peel off the security seal from the chain of custody form. Place the security seal where the top of the bag meets the center of the bag. Write the date the patch was removed on the security seal and initial it. There is a picture of a properly sealed bag on the chain of custody form. Once the absorbent pad has been properly sealed in the specimen bag and recorded, remove the outside covering of the sweat patch from the arm. Notice how firmly the patch is sticking to the skin. It is important to note the feel of a well-adhered patch so that you can easily identify a reapplied patch. It is recommended that you hold the transparent covering of the patch up to the light after the patch has been removed from the skin and the pad has been removed and stored. Look for needle holes in the cover. However, very small needle holes may not be detected using these procedures. If the patch appears to have been tampered with, note it on the chain of custody form or in the logbook. After the visual inspection has been completed, you can discard the transparent covering. Complete the chain of custody form in the donor's presence. Place the plastic specimen bag into the transport bag with a second ply of the chain of custody form. The absorbent pad requires no refrigeration. However, high temperatures should be avoided. The worn pad can be stored at room temperature for up to a month. Place the transport bag into the appropriate shipping envelope and send to the laboratory for testing. Several patch transport bags can be placed in a single shipping envelope before sending to the lab. The points to remember when removing the patch are: check the patch ID number to make sure it matches the one written down. Wear disposable gloves. Use the single-use tweezers to handle the patch and place it into the pouch. Check the patch for any signs that it may have been compromised. Record the date the patch was removed on the chain of custody form. Once the absorbent pad reaches the laboratory, it will have a screening test performed on it. If the screening test is positive, a confirmation test using tandem liquid chromatography mass spectrometry will be performed. The PharmChek sweat patch contains no chemical compounds which are known to cause skin irritation. If skin irritation should occur while wearing the patch, it should be removed immediately and the skin appropriately treated. If the skin irritation appears serious or requires medical attention, immediately contact a doctor. Thank you for choosing PharmChem for your drug testing needs. If you have any questions about the sweat patch, its application or removal, or how the sweat patch is tested in the laboratory, please contact PharmChem at 817-590-0571 or 817-590-2537.